Okay,
Yay!
we figured it out.
How are
I am doing so good. How are you?
you? Good. I'm so
Hello, hello. Come on in, everybody.
I
How
love
are
we're
you feeling?
pink.
What'd you say?
I said I love we're both wearing pink red shirts.
Red hair, pink. It's on brand for me. Some form of red at all times.
So we'll just give it a second to see if people show up.
Yes, yes. I'm so excited about this. I don't know if you are.
I am so excited about this. I've been waiting for it. We've had to cancel and everybody
Yeah.
did periods for sure.
Yes.
How is
So
everything in the business?
it's growing, and yeah, things are moving in the right direction. Of course, this is gonna. I don't know if you can hear the airplane. I'm like right here. I'm sorry. I figured I would come outside because it's just so beautiful out. I was like, oh, the lighting is perfect. Didn't remember that we live or that I work right by the airport, but that's
Yeah.
okay. We're all good. But the business is coming along. It's really starting to blossom. So I'm excited.
Good. Congratulations. And I saw earlier
Thank
on your
you.
live,
Thank you.
beautiful.
So, are you getting a little bit of a delay? I had just a bit of a delay.
Yeah, I did get a little bit of a delay as well. Did you
Okay.
hear what I said?
I did not.
Okay, I said your office looks so beautiful. I saw on the live earlier.
Oh, thank
Look,
you. Yeah, we're working. I'm actually meeting with my designer right after this, so we
oh,
can redo the bottom floor too.
okay.
Yeah, so we're working. I really want to make it an experience where you come and you're like, okay, I'm healing, but it doesn't feel like work, right? Because it is a lot of work to heal.
Necessarily more like a safe, like comfortable.
Yes.
Yeah,
Yep. I'm gonna go inside because this is gonna drive me crazy.
will be showing up. So maybe we'll just give it a few more minutes.
Cool, cool. And then we can introduce each other to our audiences too. So this is me walking up the stairs in the clinic. Oh my God, what a painful.
The wall there.
It's a bunch of feathers.
Looks. Oh,
Yeah.
that's. Oh, my mic's not working. Someone just said.
It's I'm sorry, what'd you say?
Someone said mic working. That's weird.
Hmm.
Hmm. Can you hear me now? You can
I
hear me.
can hear you.
Um. Okay. Okay. Okay.
I
So
hopped on earlier to get a little bit of practice in.
yeah, is this, I haven't done a live yet, so this is my first one.
But we are doing it and that's what matters, right?
Exactly. Exactly.
Okay, I'm ready to get started if you are.
I'm Allison, the co-founder of Red Moon, and this is Jenna. You want to introduce yourself, Jenna?
Yeah, I'm Jenna Perkins. I'm a women's health nurse practitioner, and I'm the founder of DiscovHer, which is a women's wellness center in Alexandria, Virginia. And I see patients in DC, Maryland, and Virginia.
And we are here to take Jenna about periods and maybe some CBD information. And so, just to kick things off, I wanted to know, what inspired you to dive into female health and wellness?
I think just being in a female body myself, right? It just
Yeah,
was the logical thing. I had my first exam as a teenager, and I remember thinking, this is terrible. There
yeah,
has to be a better way. And I was fortunate enough to grow up around my grandmother, who was a healer. She did folk medicine
Oh, wow.
and spiritual healing.
That's
And
amazing.
so healing, yeah, healing was always something that I knew that I wanted to do, because she was just bigger than life, right? Like, she was always the goal, and so I just wanted to be like her, and figuring out how to do that. It just was like, okay, if she could heal the people that are in her life and, you know, do it in a way that comes naturally, I can do the same thing. So being a woman, being a Black woman, it just made sense for me to be in this space because I'm comfortable in this space. And
Definitely.
so it was just natural.
You talked about exams being so uncomfortable. I've had so many exams because I have endometriosis, and it's always been such an uncomfortable thing for me. So, what ways do you make it more comfortable for women now that it's something that you have to do for your work, and like some input for women, like how to make it more comfortable for themselves too, because it is such an awkward, uncomfortable experience to have exams like that.
Mm-hmm. The first thing is picking a provider that you feel comfortable with, right? So just knowing that you don't have to choose somebody who accepts your insurance or somebody who you are given a referral to, like being very strategic and coming to it from a space of knowing that you have options, right? So not just choosing anybody, any old body, right? Like, you need to make sure that you are going to be comfortable with the person. And also, just like any other service, you can try people on for size, right? If you go in and you're doing your initial consult, even before you do the exam, and the vibe is not vibing, if it's not feeling good, then you can always say no. You can say, okay, this is not something that I want to do today.
Yeah, yeah, for sure. And
Um,
go ahead.
I was just going to say, my other big piece of advice, so beyond just finding somebody that you feel comfortable with, is knowing that exams are optional. So especially with something like endometriosis, we're not getting a whole lot of information from the exam, right? Like, they're putting a speculum in there. When you do the speculum exam, you're only looking at the cervix. That doesn't tell us much of anything. So especially for endometriosis.
Oh, that I've never heard that before, that it doesn't tell.
Mm-hmm.
Every time I've had to go in, I've had to get an exam, and it's always so painful for me because of my endometriosis. But they've always been like, oh, check your uterus or whatever, like they can feel it or something. That's always so painful for me. But they've
Mm-hmm.
insisted that I need those every time.
You don't need it.
That's good to know.
Mm-hmm. I have lots of patients who have never been able to have penetrative intercourse. And really, when we're doing a pelvic exam with a speculum and a pap smear, what we're looking at is the cervix for signs of cervical cell changes and signs of cancer. If you have not had penetrative play, the likelihood of you having HPV that then leads to cervical cancer is very, very low, right? So don't feel like you just have to push through because somebody told you. You know, advocate for yourself and say, no, Nurse Jenna told me I don't need this. I probably don't have cervical cancer.
And I've noticed too, a lot of women with dysfunction, so pain with their periods, and stuff like that. Even women with endometriosis and fibroids oftentimes get misdiagnosed for so many years, even though they're going through all these pelvic exams. A lot of times doctors don't take their pain seriously, and it's just supposed to be normal that periods are painful. What is your feedback on that? Because we know it's not supposed to be, right?
Yes, yes. Hey, everybody, come on in. Periods are not supposed to be painful, right? A period is the culmination of fluctuations in your hormone cycle. And that bleed that you see just means that the uterine lining is shedding, right? So a period is not necessary. You don't have to have a period to be a woman, right? And also, if you do have a period, it is not supposed to be painful. And if it is painful and somebody is saying to you, oh, I have to do a speculum exam to see why it's painful, they're not going to get a whole bunch of information, like I said. The only true way to diagnose endometriosis is to look inside of the uterus through surgical means and see if you have, inside of the pelvis to see if you have uterine tissue that is outside of the uterus, right? And so that's when you really get the diagnosis of endometriosis. Now, with your pelvic exam, or with my pelvic exam, I'm examining the pelvic floor muscles. So looking at all of the muscles that control the bladder, that control sexual function, that control the bowels, and I can assess if those muscles are tight, if they're tender, if they are dysfunctioning, right? You don't do that with the speculum in place. So
No.
one of the questions you can ask your provider is, if they are demanding, right, that you have this exam, what are you looking for? And what information can you get without the speculum?
Okay. That's really
right? And if you have a pelvic floor specialist like me, what we're doing is we're just gently pressing on the muscles. And if you have pain, that tells me a whole lot, right? So even if I just do some of the exam and I press on the muscle slightly and you have pain, okay, that tells me you probably have pelvic floor muscle dysfunction, and we can create a plan around that. So throughout the entire exam, I'm constantly reiterating the fact that this is optional, that you can withdraw consent at any point. We don't have to go through the entire exam. You know, we can stop at any point. So know that, and the next time someone says like, oh, you have to have an exam, you can say, no, I don't. And even if you're in the middle of the exam and you remember this conversation, just say, okay, now stop.
Yeah, because it is, and I feel like women who do have issues have to get a lot more exams, and it often gets kind of feeling a little bit traumatic at times, because it's like repeated exams, and different doctors, and so yeah, it's good to know that you don't have to accept those, and that you can take to figure out what's going on with pain.
Yep. One of the things that I do in my clinic is that the syrups that you usually put your feet in, they actually are optional.
Really? See, I've never they're optional. It's just like stick your legs up, pull your, scoot down. Let's do this, and it's like
you don't need syrup. And another thing I offer is, if I'm doing a speculum exam, because I have to look at your cervix or look at the vaginal canal, you can put the speculum in yourself, right? We can go slow. We can put numbing cream on there so it's not as painful, because oftentimes the pain is coming from the vestibule, which is the hallway or the opening from the vulva, which is the outside that you can see, into the vagina. So that very specific opening is the cause of a lot of pain. And so if we can numb that part before we do a speculum exam, that's easy peasy. And it takes a couple seconds to put some cream on and wait a little bit.
I'm surprised to hear a lot of times that women don't know a lot about how that they should, be the questions they should be asking, the things that they don't have to deal with when they go to their gynecologist, and all that stuff. So what are some of the craziest things or the weirdest things you've heard about, like, period myths or, vagina myths that we can bust right here and right now?
The biggest one is that the vagina is something that you can see. So when people come and say, oh, my vagina, I'm like, you've never seen your vagina. You don't know what your vagina is, right? What you're talking about is your vulva. And there is power in naming things. And if you can say my vulva, my labia, my clitoris, like if you have the tools to be able to use those words, and then that's going to say to your provider, oh, she knows what a vulva is, right? Like, let me be on my P's and Q's. Let me, make sure that I'm on top of it.
So it's very layered.
Yeah, so that's the biggest thing. And with every exam that I do, I hand you a mirror. And so I will say, this is your vulva. The vagina's inside. That's not your vulva. These are your labia. This is your clitoris. Does your clitoris have movement? Can I move the clitoral hood so that the same way a man, if he is uncircumcised, can have the tissue adhere, right? It's called phimosis. You can have that in the clitoris, right? Is there movement there? That could be a reason that you're not having orgasms. That could be a cause of pain. And so if we're just doing that speculum exam and skipping the vulva, then we are skipping a lot of function and skipping the opportunity to heal a lot of dysfunction.
Speaking of vulva, one of the biggest things we get, how does the CBD get into the vagina? And I feel like that is a good question for you to answer, because a lot of women don't know about the permeability of their, they just don't. They don't know that they're the skin. That's something that you are aware of and that you can talk about?
Yeah, so I like to describe it as the lips on your face and the lips down below, right? So outside of the lips on your face, this is regular old skin, right? But inside, you have the permeable skin and tissue that we were talking about, right? So it's more membranous tissue. And so when you have more vascularization, more blood flow to an area, then you're going to be able to absorb more of whatever medication you are putting there. And so that vestibule that I was talking about, that hallway, is that transition zone between the normal skin where the hair grows on the vulva and that vaginal tissue that has that good vascularity, right?
Mm-hmm.
And so if you are putting medication inside the vagina or located at the vestibule, at that opening, then it's going to be able to permeate into the tissue more than it would if you were to put it on regular topical skin, because it has just that vascular system.
Sure. And it's also a really good reason why women should be using organic, clean products when they're menstruating, right? I mean, because we're absorbing all the things that are there. It's, even for our cases, we have CBD in our products, but some products have chlorine or other chemicals. Body's absorbing these indiscriminately. So really use these clean.
I like to say, if you wouldn't put it in your eye and you wouldn't put it in your mouth, then it doesn't go in the vagina.
Exactly. I like that.
You're not going to put bleach in your eye. That's common sense.
No. Or just like plastic. I don't know.
Right.
Yeah. So as far as periods and period pain, what would you say, you know, when is a good indication like your pain is too severe, you should see a doctor?
If you are questioning it, then you should see somebody. Okay, so if you are like, you know, this might be a little bit too much, then that means that you are distressed by it. The amount of pain that you have is very subjective. And if it is distressing to you, even if subjectively you're saying like, oh, it's only a 2 out of 10, but it's keeping you from being able to go to school, right? Like you can't engage with your family. You can't work. If you're not being productive because of the pain, then there is help out there and you should see a specialist. And also know that your regular OBGYN is not a specialist, right? They are not endometriosis specialists.
Yeah. They're oftentimes going to refer you to someone who's a specialist.
Mm-hmm.
And I've realized recently too, a lot of doctors push for, I've noticed this, they push for more when you have endometriosis or fibroids. What is your opinion on that? Because I've heard mixed things about hysterectomies, specifically for women who are in their late 30s. And, you know, should you get a hysterectomy before 40 if you're in pain? Or is there some risks that come with hysterectomies and stuff like that?
There are for sure risks that come with any surgery, right? Anytime you cut open the skin, you have risk for scar tissue forming, and you can have subsequent dysfunction because of that scar tissue. So it's still a major surgery, right? There's always the risk that it doesn't work, because if you have endometriosis and you have lesions that are not in the uterus that are causing your pain, but you leave those parts there, right? Like you leave that tissue there, then your pain can still come, even though you are not necessarily having a bleed, right? Those endometrial lesions are still responding to the natural fluctuations in hormones because you still have your ovaries. And so you could still have pain after surgery. And if you have been misdiagnosed, if someone has said to you, oh, your pain is because of your uterus, and truly your pain is because of these pelvic floor muscles, right? Then your pain is going to be there. And now you've added major surgery in your abdomen that's going to cause even more insult. So there's a risk that it just doesn't work. So if you have a general OBGYN saying, okay, you have endometriosis or you have pain, let me just take.
A little.
Can you hear me?
Yeah, I can hear you now.
Okay. Then that is something that you want to think twice about.
Okay. And I've heard, and I don't know the myth, I've heard it can change, hysterectomy could change your organ.
Yes. Anything can change your orgasms, right? If you're not in the mood, then you might just have a worse orgasm, right? So again, if you are adding major abdominal surgery, if you are causing more insult to the muscles that are in charge of orgasm, then you have the likelihood that you're going to have that orgasm impacted in some way. So in order to orgasm, what is necessary is that you have to have these contractions of the muscles, right? This build up, this engorgement of the clitoris. I just think of a clitoris as like an embedded penis, right? And so if you if you have a flaccid penis, that's no fun,
Yeah.
right? Like we know that yes, you can have an orgasm with a flaccid penis, but maybe not as good of an orgasm. And so we have that in our heads that like men need erections in order to have good, satisfying orgasms. And women need the same thing. We need this blood flow. We need this engorgement of the vulva. We need this engorgement of the clitoris to have really good orgasms. And so if the muscles that are getting, damaged in surgery, if those muscles are unable to contract in that way, then you're going to have weaker or non-existent orgasms.
Wow. That's something people don't want.
No.
Sex, right? That's something that you specialize in?
Mm-hmm.
What should you do? Like, what are some of the things that you can advise if you have painful sex?
Well, first and foremost, come see me if you live in DC, Maryland, or Virginia. But I have a website, discoverhealth.com is my like kind of main page, but I also have a shop where all of my products that I recommend are available. And so if you visit nursejennarecommends.com, you can find a section that is all about pelvic pain. Okay.
And it gives advice doing product. You have some products that help with painful sex.
Mm-hmm.
Favorite products for painful sex?
I'm going to shout out ONUT, OHNUT. This product is I'm going to get it in a second, but it's these soft cushions that you can put on your penetrating partner. So whether it's a toy or a penis or a finger, you can basically stack these rings to customize the depth of penetration.
Okay.
So,
probably that's what causes pain, is it's going too deep, or
in some women.
Mm-hmm.
In some cases, if those muscles posteriorly are very tight, when you have that deep penetration, then you're going to get lots of pain. So this is the ONUT. And this is great because it was created by a woman who had pelvic pain herself.
Oh, wow. Okay. And then you can decide how many you want to use.
Mm-hmm.
Interesting. That's unfortunately.
Could you repeat your question? I'm sorry.
No, I said it's a great product. I know a lot of women, unfortunately, who experience painful sex.
Mm-hmm. Yeah. So if they're having penetrative play, it stretches. Like there's no partner that's too big for it. So that's something that you don't need to visit. You can buy that and you can play around with it. Start with all 4 rings and then move to 3, to 2, then to 1, and then to none. Another thing is there are lots of great books that are on the website. So nursejennarecommends.com, and you can find great books to learn. And I think that the best thing that I can do for patients is really to teach, right? To teach you about your body, to teach you about what's going on, to empower you so that you can advocate for yourself in other medical spaces, especially. And so if you are armed with information, then you are going to get the results that you need so that it doesn't take you 5, 6, 7 referrals before you end up with somebody like me.
Yeah, which is important, I think, because it's such a it's such a big part of our lives. Our hormonal health. I mean, we have periods for 30 years or something like that. So keeping up on your hormonal health is very important, and
even beyond having your period, right?
What?
Hormones still come into play even beyond having your period, right?
Exactly. It's a cycle. So the hormones are what cause the period, right? But it's also yes, very important for us.
Yes. So another question. So you asked some tips for advocating for yourself for exams, and another thing that is important to know is that we talked about like the cervix and the pap smears. Those pap smears, so needing that speculum, the guidelines have changed, and so it's not yearly anymore, right? You don't have to have that speculum exam every year. You don't have to have a period, right? But you don't, a lot of my patients feel pressured, like, okay, I need to heal because I need to get this done and I need to check this off. And so I have to do a lot of reframing to say, you need to heal because you need to heal, because you want to live your life and you want to sit comfortably and have sex comfortably and be able to pee without pain or have bowel movements without pain, right? Like, don't let the goal be for someone to do something to your body. The goal should be for you to feel comfortable in your own body. That's the purpose of healing.
And how experience that CBD is all of period pain, stuff like that?
So we have CBD receptors all around our body, right? And we definitely have them in the pelvis. And I started to offer CBD products because I use them personally. And I was like, oh, there's something to this, you know, like this is not just I'm being edgy and I want to use marijuana. It actually provides like great pain relief. And I also wanted to do more research into it because a lot of my patients were self-medicating, right? So they were using with CBD, with, you know, marijuana, with CBD, THC. And so I wanted to learn more about it. And so what I did was I actually signed up to become a certifier in the state of Maryland. And so they take you through this training and they teach you all about like CBD and THC and the side effects and the benefits also.
Okay, what did you discover in the research and the training?
Discovered that CBD use has been around since the beginning of time.
Yes.
Right. And so really it was just the politics and the political environment that caused us to stop using it as a source of healing. And for me, I was like, okay, now I understand. Now I get it. This is not because CBD is bad or because marijuana in general is bad. It's because the politics surrounding it, you know, has been, the drug has been demonized.
It's definitely a medicinal plant. And for me, CBD, I use CBD for sex and for my period. And it's been so amazing. I don't like taking ibuprofen, stuff like that. It's really bad for your gut health.
Mm-hmm.
I mean, in severe cases, if you're having severe pain and you absolutely need something, you should take medicine, of course, right? But
Mm-hmm.
something that's, you know, more natural and that actually works. And to me, CBD, that's why I created this product, because for
Mm-hmm.
thing that is natural and it actually works.
And so that's why I'm such a fan of yours, and also why I'm such a fan of Sarah, who started ONA, is because this is not a top-down approach. This is, you all are people who are experiencing, are women in female bodies who are experiencing pain and responding to it. And so I'm like, okay, this is what we need to be doing. We need to follow the people that are being affected and then have our approaches and our clinical tools come out of that. So I love it. I'm all about it.
Thanks. I love it too. I love seeing women create things because of their own, because I feel like for so long, and you being in the medical field, you probably know this, for so long it was dominated by male doctors and male researchers, and we're just starting to discover, you know, more women coming into research for feminine health and more products being developed by women for women, and it's a really good time to be in the space that we're both in.
Femtech.
Yes, femtech is very empowering for women. And I love it because we know our bodies more than anyone. And over the years, I've had to argue with doctors. Like, no, this is what's going on in you. Like, how can you even relate? You've never given birth. You've never had a period. You've never, you know, but
and they're following the research, right? And so it's important for us to be mindful that the studies are being done on male bodies traditionally, right? So the way that we understand the world is very, you know, male. It is very European, white male, right? These are the people that whose bodies we have studied. And so the medications that we give are designed to help those individuals. So of course, me as a Black woman, what works for my husband, who is a white man, might not necessarily work for me because we have two different bodies, right? And so our bodies work differently. So we need to have the studies and the research on Black bodies, on female bodies, so that we can have evidence-based practices.
Yes, yes. And even more so, like you said, like Black women have so much issues with fibroids more than white women, and women of other colors, but there's not a lot of research on why that is and what's going on there. And I think it's really important that we study every woman and figure out what's going on. It's crazy. It has
Mm-hmm.
very white, male dominated in the female research world.
Mm-hmm.
I'm glad there's women out there.
Thank you, thank you. My background is in research. I came to medicine from research. I actually did HIV prevention research in undergrad. And so that got me talking about sex comfortably. And so this was just kind of a natural progression. Like, oh, I can talk about sex. I'm a woman. I'm in a female body. I could help heal me, right? Like my entire practice is how would I want to feel on the receiving end of this? What type of space do I want to be in? What type of exam would I like?
Yeah, and that's important. I mean, because a lot of times you go into doctor's offices and it just feels like cookie cutter, like cold, sterile, you know, kind of icky going to the gynecologist never.
Mm-hmm. Or then you have the other side of that, which are all of the med spas that are popping up everywhere. And then it's like, okay, I can go here and I can get vaginal regeneration or vaginal rejuvenation. But is this a trusted source? You know, I'm comfortable here. It's nice. It's cute. But do they know what they're talking about? So I
Oh,
think that
that's something to think about because I have heard of, I haven't done it, but are you talking about like the Yoni Steams and all those kind of places? Yeah. I've wondered about those. Like, I wonder what that is. Is it a good thing to do, the Yoni Steams?
okay. Let me get up on my soapbox first of all. The Yoni steams are a traditional practice, and I think that they have a place for sure. I think that the claims that a lot of these practitioners make are BS. They're snake oil. You have a vulva that is the same tissue as the tissue in your elbow, and you are telling me that these herbs are going to magically end up in the vagina and fix my hypothalamus that is causing me to have PCOS? It doesn't make sense, right?
They're claiming they can heal PCOS.
Right.
Oh,
They're claiming that they can heal endometriosis. They are making a lot of
they're
claims that are not true.
heal things. I didn't even know that. Okay,
So
interesting.
that is dangerous because you're delaying care. You are causing women to not trust providers if you are or practitioners, right? If you're giving false information, so that is very dangerous. But there is room for the steaming, right? The same way that you feel better after you get a facial, same thing, right? Like it causes you to be in a meditative state. It causes you to check in with your body. It causes you to check in with your vulva to get to know yourself and get to know your body. So I think that there is definitely a space for steaming, but I think that a lot of people make claims that are untrue, frankly, and it's dangerous and it's not okay.
Can it cause any sort of infections or?
So anytime you have like a hot, wet environment, there's a potential for you to have a yeast infection form. So hopefully your practitioner is making sure that you like dry off completely and giving you good advice about using, comfy white underwear without a bunch of chemicals and dyes. And that can really, really reduce the risk of that happening. But again, wet, damp environments create
Yeah.
growth.
Okay. Uh, yeast infections. I'm going to switch the gears just a little bit as a founder of a menstrual pad company. I'm going to ask you about tampons. And do you use tampons and what are your opinions on tampons?
The great thing about my own body is that I have rarely had a period in the last 4 years because I've had two pregnancies and now I use the Mirena IUD. So not having a whole bunch of bleeds,
Yeah.
but um, tampons are not the things that I reach for ever.
Yeah.
The idea of grabbing a wad of bleached cotton and sticking it up inside of my vagina is just like, no.
Yeah. Yeah. Which brings to I feel the same way. It weirds me out and I feel like it makes me feel dry. And I've done a little bit of research, and I want to just get your expert opinion. Does it absorb indiscriminately, which means not just blood, but everything else that's in there? It's gonna absorb,
There's
and it's
everything.
out, and it comes with a lot of risks, right?
Yeah, I wouldn't say that it comes with a lot of risk, right? But toxic shock syndrome is a major risk, right? Like the sensation of the dryness is a risk. If you have very thin, what we call friable tissue, you could tear. Discomfort is a risk
My
too.
thing with tampons,
I'm sorry, could you repeat the question?
like getting caught up there in the vagina from the
Yeah,
cotton, like microfibers getting left in the body. Yes.
yes. So toxic shock happens when the tampon itself is left in place too long. So yes, because of the fibers, but the risk of the microfibers getting caught up there or staying longer than necessary after the tampon is removed is pretty minimal because your body does a great job of creating mucus.
Love tampons, but I feel the same way you do about that shoving cotton up there.
Yeah, it's not fun. And then it's the first thing that we hand young women with no instruction, and it's like trying to do physics to figure out how do you even do it.
Whole thing up there, like with the applicator
The
and everything.
plastic.
Yeah. Like, no, you have to take that part off. But yeah, yeah.
It's also interesting because we're so disassociated from our vaginas and from our vulvas that we would rather just stick something up there than see our own blood, you
Yeah,
know?
yeah, that's a thing too. It's like they're like grossed out by their own body functions, when blood is actually it's actually one of the cleanest types of blood too, from what I understand, your period blood, because it's actually what produces life. So it's like full of kind of really strong,
Yummy growth factors is what I
yeah,
call.
um,
Yeah.
and all this kind of stuff. So it's actually really, really cool blood.
And it tells you a lot, you
Being
know?
very different blood from like when you cut yourself, you
Right.
know, it's like superpower blood.
Yes. Vampire blood. It's actually what the vampires are wanting is your period blood. Um, yeah, but blood freaks some people out, right? In general. So if you cut your finger or if you're bleeding from your vagina, some people are just like freaked out about it. And I get that. Um, so it's different strokes for different folks. And that's why it's great to have so many wonderful options.
Yeah, there are so many good products out there right now for your periods. So it's a good time to be a woman or a person who has a period. That's for sure.
But there's only one company that does CBD products inside of the menstrual products, which is so dope, which is why I was like, okay, I got to meet Alison. We got to do some work together.
Thank you, thank you. Yeah, I love my product. I use it every month, and it's helped me so much. So I'm glad other people are loving it as well.
Yes.
But anyway, I'm so excited that we got to do this. Thank you
Yes.
for coming on and sharing all your expertise with us and talking about periods and sex and vulvas and all that fun stuff.
Yes, this is a pleasure. It was a good time.
Yeah, thanks so much. And so we should do this again really soon.
Let me know. I'm always up to talking about the most intimate things, which is probably why I'm so nervous about being on social media because so much of it just feels like fluff
Yeah,
almost.
sure, for sure. And so
I'm
we can
like,
talk about
let's get to the nitty gritty, you know?
hormones and all that stuff. I'm totally okay with that. Anytime you want to chat about it, let's jump on.
Yes. Awesome. Oh, this is so good. Thank you for having me.
Of course. Take care.
You too. Bye, Allison.